Welcome to Priya Health and Fitness Academy. Today we are particularly focusing on the assessment of what's going on with our knees. If you have pain in the front of the knee, going downstairs, upstairs, doing lunges, squats, hiking, doing the stepper, or even running, you may have what we call joint compression. Now the joint compression is interesting because it really has nothing to do per se with the joint. That's what oftentimes that's where the pain is experienced, but oftentimes it has to do with the muscle groups that are above all this. Usually the muscles are the issue, not the bones. Ultimately the bones have deteriorations and that needs to be addressed, but the muscles are the problem causing the compression. So today we're going to assess the cause of what, if you are experiencing this, or if you have clients or patients that are actually experiencing the pain like this, how to really assess as to what the cause is, okay? And then you'll know basically from there the protocols that will be based for you, which in this case will be the knee protocol in the programs that we're offering at the Academy. So the assessment right here is very simple and really easy to do. Actually I can't even find an exception. I was trying to, but I've never found an exception to this rule. Anybody with pain in the front of the knee right here or inside the joint, right? Always have knots, what I call knots, right here. They look at the bottom of the legs with 3, 4 inches, 5 inches, depending on the height of the individual. And those knots right here basically shorten the muscle, creating compression in the joint. So the simple thing to do here to find out if that's the case, right, whether you work with a client, a patient, or yourself, is you put your thumb right above the knee, you put the other one on top, and you press nice and hard, and you go up. And then at some point, you may feel suddenly like you're going over a marble, or sometimes feels like a pencil, right? And you, by the way, you do that also a little bit on the inside. Quadriceps, meaning fore muscle, quadriceps, fore muscle that comes here, and comes to the hinges of the knee, right here, attached to the patella and to tibia fibula. And so the results right here is that naturally, if these muscles are tense and noddy, we shorten the muscle, creating compression, the tibia fibula coming into the femur and creating compression up here, right? It also forces the patella right here, which should have a little bit of flexibility. You should be able to move it. That's one of the tests I do when I work with people that have pain, is I'll grab their knee this way and I literally lock the patella between my thumb and I move it sideways. If it's not moving, that means I go like this. If it's not moving at all, it's super tense. Super tense. It's literally trapped in the track, the patellar track in the femur. It's a little groove at the end of the femur like this. That's your femur right here, the bone of the thigh up here. And you have a little groove right here where the patella is sliding up and down this way. And it's really super tight and trapped in there, literally locked down by the tension of the quadriceps due to those knots or fascia adhesion. The fascia is basically a sheath that is around the muscle. Think of it as the balloon. It's natural if you want to blow a balloon, it's a lot easier if you stretch it first and blow in it, and then it expands really easily. It's a lot harder if it's tight, basically, it hasn't been stretched, and you try to blow in it, and then it's a lot harder, it has a lot of resistance. The fascia is a little bit the same right here. By stretching it, it allows the muscle to actually expand, right, to elongate, which is what we want. So if you have knee pain right here, then oftentimes you'll find those knots. Again, simple thing, 2 thumbs, one on top of each other, and you press nice and hard this way. If you do it on somebody, oftentimes people who have pain here, that's what I do. I lean forward, put my thumb, and find those knots. And usually you see people squirming and making faces and not screaming, but they're hurting, you know, and because those knots can be really painful. If you have those knots here, I guarantee you your knee would feel a lot better, or your clients or patients' knees would feel a lot better once you are getting rid of those, and that's the knee protocol, okay? Another thing that we'll do here is as well is we want to see whether or not the muscle can actually stretch itself. So, a couple of things to start with. We do those, right? We press this way, we press this way, press this way. You can also grab a like if you do foam rolling, for instance, or using a pipe or tubing, you can also roll, and if you feel a big knot in a muscle up here, which happens a lot as well, like I'm talking about big one, Those by the knee usually are marble size or pencil size, sometimes golf ball size. I've seen that, it's kind of crazy. But up here will be really big, like it will be literally about that size right here, and you really feel this, and then the muscle jumps suddenly, and that's pretty painful for the individual or for yourself. So that would explain why the muscle is so much shortened, and as a result, creating compression in the knee. Now, another thing we want to do is we want to actually simply lift our leg this way and just bring the foot toward our heels toward our hips right here, and see if we feel any kind of stretch or pain right here. In that case, you know it's the bottom right here. Now, the next thing is we'll do another stretch to evaluate if the tension up here or the knots in that area are actually the culprit as to why we have pain here in the knee. So now we're actually going to test the muscle itself, right? Not just the bottom right here by the knee, but we're actually going to see if the muscle is actually stretching, right? And what tightness we actually really experiencing that would explain why we have the pain in the knee. Again, I have never found yet in 30 years of working with people, actually longer than that, that when there's knee compression and there's pain in the front of the knee or inside, I've never found a muscle that actually could elongate and really stretch really well. The key is also, in order to be really efficient in what we will do to correct that, right, via exercises, stretching, rolling, and all that, pressure points and all this, we actually going to find out first where the prime is, right? And of course, we know toward the bottom of the knee, that's pretty much a guarantee. But is there any more prime here, or is it also hip flexor related? Right? So what we do here is we hang on for stability, and you do it yourself, or you ask of the person that you're working with who has pain in the knee to try to grab the foot right here. Oftentimes you see they'll be like that. Sometimes they can't. They even just right here. Well, you know that's already a telltale sign right there that we have an issue with the quadriceps, right? And then if sometimes they are here and they're pulling their hips here. If they pull the hips here, it means the hip flexors are super tight, and they might feel tight really low here as well, right? Sometimes they just go here and they feel super tight, or they're here, and and just ask them, where do you feel tight? Now, obviously, when you've done this long enough, if you work with people, you will see where the tightness is automatically, right? Depending on where it is. So in this case, if that's the case, that you have a hard time grabbing, or that the person you're working with has a hard time grabbing here, or that the knees forward, they are like this, like that, or they can't even come close to the knee right here, we don't need to force the stretch. We don't need to force anything. We know that the muscle is extremely tight, and if you found those knots right above the knee, then we know the knee protocol will do wonder for them, literally wonder. Okay. I also suggest the knee protocol specifically for people before they do surgery. Okay. Sometimes the bone so deteriorated that you cannot really avoid surgery, and so there's absolutely no need for someone to suffer that much and for so long. Surgery is very efficient, and the key right here, using the knee protocol before surgery, would actually allow faster recovery. It's extremely valuable. So from the perspective of either a physical therapist or a personal trainer whose job is actually to give corrective exercises to help someone be in better shape, well, we're talking about putting a muscle in better shape before surgery by having an elongation, a healthier muscle. So after recovery, after the surgery, recovery will happen so much faster, so much easier, so much less pain, and all that is so valuable. And I have seen that working wonder actually for a lot of clients of mine and people that I've worked with. So my suggestion here, if you have found out that you had knots and you were very tight, or the person that you were working with has those symptoms, those issues, then I suggest definitely the knee protocol is the one for you.